Hello, and thank you for joining me. I am Stephanie Thompson, Special Needs Planner for Special Needs Mom Squad. Today we're going to be going over the basics of government programs. So before we get started, I wanted to make sure everyone's aware of our quick disclosure. The information that you're going to see here today is not provided or intended to be used for specific tax or legal advice. Every situation is unique, so please make sure that you reach out to your local tax advisor, legal counsel, or estate planner to see how this information will apply to your situation. So a little bit about Special Needs Mom Squad. We opened in May of 2018 and truly have been a blessing to reach so many families. We're based in Illinois, and what we do in the community is we create sensory-friendly activities and events. We also provide workshops for families and organizations. And then for a one-on-one basis, we do offer consultations with families who are seeking special needs planning. So what exactly is special needs planning? What it is we create action plans for the what ifs in your life. So what if mom and dad don't come home today? What if someone loses a job? What if you move out of state? What if a disability improves, or what if you receive an inheritance? There's so many what ifs that we try to get together as a team to plan for those. So we work with your financial planner, we work with your attorney, we work with your tax consultant. Everyone who's part of that team, we try to coordinate with. Another piece that we do with special needs planning is we make sure that the plan is implemented. You can spend countless amount of hours, unlimited dollars, trying to get everything in line, but it doesn't have any impact unless you execute it. So one of our jobs as special needs planners is to make sure that the wishes that you want are fulfilled with the implementation of your goals. We also like to collaborate because laws constantly are changing and every state is different. It's so much information that it's difficult to be a parent and know everything that's going on around you. So we try to collaborate with you and let you know of any kind of important laws that have been changing in your area. When we look at government programs, it's important to note that there's two separate types of benefits. There's a needs-based benefit and then there's an entitlement benefit. What's the difference? Needs-based is for a benefit you've never paid for, so it's a necessity, something that you have to have. Your entitlement benefits are for the payments that you've put into Social Security or into FICA. If you look at your paycheck, it's something that you've paid for. So that's the main difference. We're going to start off with needs-based, and you'll see it highlighted on the screen. We're going to look at supplemental security income and Medicaid. If you're in California, you're going to look at it as Medi-Cal. For 2020, we had an increase in our cost of living adjustment. We had an increase of 1.6%. So what does that mean to you? It means that your Social Security benefit went up. So if you take a look here, the monthly amounts eligible are going to be $783 for an individual, and that's the maximum per month. $1175 is going to be for an individual with an eligible spouse, and then $392 for an essential person. And where you want to find that is right off the web at ssa.gov. How do you become eligible for these benefits? Typically, there's four main factors to consider. First of all, they want to know what kind of disability you have. Is it severe enough to constitute as a disability per their requirement? How much income do you make? Do you max out of what the limits are? What about your resources? How much money do you have to your name? And then finally, what is your citizenship? We're going to start off with the income definition. So if you look here, the income definition is essentially anything that you get during a calendar month. It can be in the form of cash, food, shelter, or something you can use to get food or shelter. So that's pretty specific. Let's see what that looks like as far as how you can see what your maximum income is, because there is a certain calculation that they have. You have two types of income. You have something called earned income, and that's going to be anything that's going to be your W-2 or your self-employment income. Then you have unearned income, and that's going to be anything that's going to be such as a dividend check or any kind of gains that you make from investments. If you look at the earned income, the calculation goes like this. They will take 2 times the maximum benefit for an individual in this example, which if you recall, $783 a month is what the limit was for an individual. So multiply that times 2, it's going to get you $1,566. Now, they give you $65 as a freebie. Why? I don't know. That's just part of the calculation. So you're going to take your 2 times your benefit plus $65. That means that you can bring home $1,631 a month. What if you bring home $2,000? Well, that's going to count against you. If you have unearned income, remember we talked about dividends or capital gains, anything that's unearned income, same type of formula, 2 times the benefit equates to the $1,566, plus instead of $65, they give you $20. And that would equate to $1,586. If you want to find more about the countable incomes, just go to ssa.gov right here, and it'll show you more details of the calculation. A little bit deeper dive into earned versus unearned income. You'll see here on the chart some examples. Your earned income, as I mentioned before, would be your employment wages, your earnings from your self-employment, bonuses, severance pay, commissions. But what about your unearned income? That would be if somebody gave you a gift, pension income, unemployment income, interest earned, as I mentioned before, and even child support payments. Now, if you look here, the little asterisk, Social Security may not always count an entire child support payment as unearned income, so you want to consult with a specialist for more information on how that applies to your situation. So we talked about the income. Now let's talk about resources. As I mentioned before, part of the 4 main factors to qualify, one of them would be a resource. Anything that you have ownership. Look at some examples here. Cash, bank accounts, stocks, U.S. savings bonds, life insurance. So I'll stop there for a second. Life insurance, how is that a cash benefit? Some of us have term insurance. There's no cash benefit to that unless you die. So that wouldn't count. But there's life insurance that is called whole life insurance, universal life insurance, variable universal life insurance, index, so many different insurance policies. If it has cash value and you own it, that can be converted to cash. U.S. savings bonds. What if you forgot that you had a U.S. savings bond? What if your parent gave it to you when you were a kid and you completely forgot, but you found it? Well, that's considered an asset as soon as you cash it in. Be careful, because if they find out that you were deliberately hiding your bonds, they could come back to you and ask for you to claw back all the money that they've given to you. So be careful of that. How do they know about savings bonds? The IRS does communicate with Social Security. They do talk. So make sure that you try not to deliberately hide that information. An UTMA account, what is that? It is an account that most parents will buy for a minor. In some states, at the age of 18, this account will convert to that minor's possession. So for an example, if you bought your son or daughter a savings account whenever they were little and you lived in the state of Illinois, our rules, they go to age 21. So you as a parent can have ownership of this account until they are 21 in the state of Illinois. Once they're 21, guess what? Now it is their asset. And if they are on supplemental security income, this could disqualify them. Finally, an IRA or a 401k. So if I have these, which most of us do, how much are you able to have? Right here, folks. $2,000 for an individual or a child, and $3,000 for a couple. and that's it. So most of you are saying, okay, wait a minute. They want me to have limited income and hardly any money to my name? What can I have? Well, here are some resources that don't count against you. A house. Everybody needs a house to live in. Prepaid burial. A car. Look at the car. It's a Ferrari. I did that on purpose because as of 2015, your car can be valued whatever dollar amount, they don't care, as long as you have a vehicle. That won't count against you. And the $2,000, as I mentioned before, for an individual, or $3,000 for a married couple. Now, if you look down here, you're going to see something called an ABLE account. We're going to have a follow-up webinar on this in a few weeks. Stay tuned for that. And all it is, guys, it's just another way of saving money that is going to allow you to still qualify for certain benefits. And then a special needs trust, I'm sure that most of you are aware of that. That's going to be another way that you can shelter assets. We talked about supplemental security income. Now let's jump into Medicaid. Medicaid is another piece of those needs-based benefits. And good health is so important to everyone. If you can't afford to pay for medical care right now, Medicaid can make it possible for you to get the care that you need for yourself or for your loved one. The main things that Medicaid will cover: hospitals, prescription drugs, and physicians. But keep a note that not all physicians are covered under Medicaid program. They have to participate in it for them to accept that as a payment. Here is a list that will outline the mandatory Medicaid benefits which the states are required to provide under law. I won't read the slide for you by every line here, but what I do want to make note is that you can go to cms.gov, and what that'll provide you is more information that'll give you regarding the different services that Medicaid can offer to you. In order to get Medicaid, there's certain things that you need to have to qualify. If you're already receiving supplemental security income, you should be automatically eligible. If you are an infant born to a Medicaid eligible woman, if you're a child under the age of 6, or if you need Medicaid in order to work. The important note is 32 states currently provide Medicaid eligibility to people who are already eligible for SSI benefits. So what's kind of nice is in 32 states, when you apply for supplemental security income, you're automatically applying for Medicaid. So it does 2-in-1 for you, which is wonderful. Now, for some of the other states, they have their own eligibility rules for Medicaid, which are different from SSA or SSI rules. Separate application has to be filled, and these states are Connecticut, Hawaii, Illinois, Indiana, Minnesota, Missouri, New Hampshire, North Dakota, Ohio, Oklahoma, and Virginia. This is going to be a part where I want you to definitely contact a local attorney who is well versed in Medicaid law to see how your situation is applied. You may have heard of something called a Medicaid Waiver program, and these are for children with disabilities who would not qualify for Medicare or supplemental security income. They may cover targeted services and supports, and in some states even copay for services based off of income. But as I said earlier, because these programs vary by state, please make sure that you contact a local attorney for more specifics on this. As I mentioned in the beginning, I reside in the state of Illinois, so I wanted to just give an example of some of the Illinois waiver fact sheets. So you'll see that, Medicaid does want you to have a place to live. They want you to have the health care that you need. So that's why you see every state has their own individual waivers. This again is an example for Illinois. I'll just look at one here where it's got waivers for adults with disability or delay developmentally. They provide the adult daycare, community day services, residential habilitation, occupational therapy, etc. Another government program to be aware of is called the State Children's Health Insurance Program, or SCHIP. So to qualify under this plan, you must have low income, be eligible for Medicaid, and be uninsured. Take note that the big thing to look at here is you cannot have any other form of health care covering you in order to qualify for this program. Insurance requirements for all kids. All kids is going to be an Illinois-based plan. So for those who reside in Illinois, if you want to go to illinois.gov and look under the medical programs, you'll get more information for all kids. Other states, of course, have their own plans, so make sure if you want to take a look at those, you look at cms.hss.gov. All right, so we've covered the needs-based benefits. Now let's go into entitlement benefits. Just to refresh your memory, the entitlement benefits are the benefits that you have paid for. And to remind you of how you paid for them, through typically your payroll deduction, you'll see money that goes towards FICA. That is going to go into your entitlement benefits. How do you know if you qualify? So Social Security Disability Income, otherwise known as SSDI, is going to be a benefit that's paid to adults that may have had a disability prior to the age of 22. And then they also pay out a child's benefit if it was based off of the parent's Social Security earnings records. How do you qualify for this? You have to meet the Social Security definition of disability. If you recall, I had mentioned that they have a strict definition of a disability. Here it is. It must be considered severe. It must be long-term, typically 12 months or longer, and it has to limit the availability to work. So, unfortunately, you can't break a finger and think that you're going to qualify for SSDI. It has to be something that's going to be severe and limit your availability to work. If you note, you have to have enough credits to meet the disability insured status. What is a credit? So this is whenever it's important that if you haven't done so, please take note to do this. If you go to ssa.gov, you can create an online account to see your earnings history. They don't mail out those reports anymore like they used to. They have gone green, and so now everything is online. What if you don't have a computer, or what if you don't feel comfortable doing that? Perfectly fine. You want to call this number here, and they'd be able to give you the information you're looking for. Now, credits, what those are, that is whenever you work every quarter, you get a credit. In order to be eligible for a disability insured status, you have to hit 20 credits. In order for you to have full-blown Social Security benefits whenever you retire, minimum for that is 40 credits. Let's say that you're eligible. The Social Security Disability Income, the benefits are a child's benefit in which it'll apply to someone who had a disability prior to the age of 22. It is paid on the parent's Social Security earnings record. And then, I didn't know this, but I found out that even grandchildren and stepchildren may qualify. Again, this is where you want to get that attorney involved to see if your grandchild or stepchild could qualify for benefits based off of your income. For an adult benefit, you must be unable to work. And you'll see it here, it says SGA. What does that mean? We're going to get a little bit deeper into it. But what it is a substantial gainful activity. And that is your employment. So we're going to dig a little bit deeper into that here in a few slides. You also have to have that medical condition that has lasted or expect to last at least 1 year. Here's a sample of what you would see if you went online to get an estimate of what your benefit would be. And you'll notice that it shows you at retirement age, family, or survivors. So it's time to take a look at it. If you haven't already, make sure that you create that login so you can see what your estimate would be. Another resource that's going to be on Social Security's website are their fact sheets. If you recall, I mentioned that we had a 1.6% increase for cost of living adjustment. So what that'll do for you, not only will it give you a little bit more to qualify for, but it'll also pay you a little bit more too. So here you're going to start seeing more of that substantial gainful activity. For someone in the year of 2020, if you are non-blind, you could expect to get $1,260 a month. Blind, you're going to see $2,110, and a trial work period is going to be for $910 a month. So that's going to show you the increase from 2019 to 2020. It's also going to give you those resource limits. As you'll see, those haven't changed. Your SSI payments, if you look there, $771 and $783, so that's the increase there. And then over here is going to be the average amount of payments that you're going to see after the adjustment of the cost of living. If you want to print this on your own or take a look at it for more information, again, go to ssa.gov. So what is substantial gainful activity? I've talked about it. What does it mean to me? Let's say that you are a surgeon and you get into a car accident and you are no longer able to use your hands to be a surgeon. However, you can still talk, you can still walk, but your hands are limited. You can still work according to the government. So what they want you to do is to have some type of job that will pay you up to a certain dollar amount. Over here on the chart for 2020, you'll see, again, we have the blind and the non-blind. This is the max amount of money that you can make with your substantial gainful activity. How do you prove these limitations for your SGA? What they're going to look at, they're going to look at your employment records to see how much you've put into the system, and then they're also going to want to look at those medical history records. They want to see something from your physicians saying that you are unable to do your job. One thing to note, unlike needs-based benefits, entitlement benefits don't care how much you have in assets. You can have a couple $1,000,000 to your name. They don't care. They want to know about your income and your limitations. So let's go back to that example. I'm a surgeon. I became disabled. I am doing a job right now where I can make a little bit of money, so I am meeting my SGA, and oh, I forgot that I had a group benefit. Whenever I worked at the hospital, I had a benefit for disability. So I'm going to go ahead and collect on that. And I should get my Social Security disability income, right? Careful. Group benefits coordinate with Social Security disability income. So they won't pay on both. They'll give you on both, but they'll max out at some point. Typically, in employment, I have seen about 60% that they'll go up to, and then Social Security will make up the difference. But they won't let you double dip. Now, what if you had a private benefit? So what if way back when somebody came up to you and said, hey, why don't you look at buying a disability policy on yourself? Okay, so you go, you meet with an insurance agent and you buy a disability policy. Good news, if you become disabled, you will be able to take out whatever that benefit was supposed to be upon disability. And you'll be able, if you have it, to take on your group benefit and your Social Security benefit. So if you had group insurance, you had private insurance, and you qualify for SSDI, you could potentially get 3 income sources. The big thing here is your private benefits don't coordinate with SSDI. That's how you get to be eligible for both. So let's go back to that example. I'm a surgeon. I became disabled. I'm no longer working. I may or may not be collecting from my group disability policy or a private disability policy, and I lost my health insurance. Now, typically, if you are no longer employed, you can continue health insurance through COBRA, and that'll extend on an average 18 months. However, if you go out on disability, it can extend to 36 months. Well, what happens after 36 months? Some disabilities last longer than that time frame. What do? This is whenever you look at Medicare. So Medicare is not just for someone who's 65 or older. It can also be for those who are permanently disabled. Things that Medicare covers, Part A is a given. It's included. You don't have to pay anything extra for it. It's part of the package. What Part A would cover is going to be your basic hospitalization type of care. Part B is going to be something that's optional. That you do pay for. That would be paid for typically out of your disability check or your Social Security check. And what does it cover? It's going to cover some of your doctor's bills, outpatient care, x-rays, lab work, etc. So what is this supplemental stuff that you hear about? You hear about Part C, Part F, Part G. What those are going to be supplemental packages that are going to be in addition to your Part B. So Part C, for example, is called Medicare Advantage plans. They are a Part C and B type combined plan where it's almost like an HMO plan. So if you recall, if you had group health insurance and you may go into a PPO or an HMO, typically HMO limits your doctors and specialists. You have to stay within a certain network. If you go PPO, it's open. Part C is strictly in network. So you have to remember, if you have like a specialist that you're accustomed to seeing, if they're not part of that network, it may not be covered. Finally, if you look at Part D, that's going to be the optional drug coverage plan. Well, what if you want that specialist? What if you want to have a PPO type of a plan? It's available. Those are called either your Medigap plans or your Medicare supplemental insurance. That's what's sold in the private sector. So that's going to come out of your checking account. That's what you're going to pay for out of pocket. Something to note, you cannot have Part C and a Medicare supplemental package at the same time. It's either or. Some of these plans have also helped pay for deductibles and co-payments. Let's look at another example. Let's have an individual who is on Medicaid. How are they getting Medicaid and Medicare? Here's how it works. Someone who's disabled, they are on Medicaid, they have limited assets because remember, you have to have under $2,000 to qualify for Medicaid. They make hardly any income, but yet they have to get certain medical care. You could have Medicaid pay for what Medicare won't. Some cases, Medicaid will pay for your prescription drugs and help pay for some of those bills from your doctor. These are very unique situations, so please don't expect this will happen to everyone. This is where you again want to have a local attorney involved to see if this would qualify for your situation. So wrapping up, a couple of things I didn't mention throughout the slide. For supplemental security income, currently there's only 46 states that offer those supplemental Social Security payments. The ones that do not cover them currently is going to be Arizona, Mississippi, North Dakota, and West Virginia. Another thing, if you go to qualify for Medicaid, you're going to go apply for it. They are going to want a certified copy of your birth certificate. Don't bring a Xerox, bring the original. If you apply for supplemental security income, you will likely get denied quickly from SSDI. Well, I wasn't applying for SSDI, so why did you tell me that? I only wanted SSI. Well, sometimes they go hand in hand. So they'll ask you to apply for both. If you get denied for SSDI, keep on waiting because you should get a response for your SSI. If you qualify for it, you'll see that approval. It doesn't happen overnight, folks. It can take 3 to 5 months to get that approval. They're also going to ask you a lot of odd questions that I want you to be prepared for. One of them in particular is going to be regarding deemed income. And again, I know we didn't talk about it during the slide. So what that refers to is, let's say that your child, you're a parent, so your child lives with you. Sometimes that can be looked at as income because they're living with you rent-free, essentially. So one of the questions you might get for your son or daughter could be, who do you live with? And, well, I live with my parents. Well, how are you contributing to their expenses? Or how do you pay rent? How much do you pay? So an example would be that, yeah, I'm living with my parents. Yes, they're providing support. I understand that's going to reduce my income. However, your answer would be, I live in a separate household within their home, and I pay my fair share of expenses. Or you could say, I'm paying my parents' room and board. So keep that in the back of your mind because they could come to you and ask those questions. Be prepared on how you want to answer that. If you found this webinar useful, if you enjoyed it, please stay tuned for our upcoming webinars for ABLE Account Basics. That's going to be Sunday, February 16th at 2 p.m. Central. And then we have a special IEP deep dive with Wanda Malone. She is a local IEP expert, and she is going to be joining us Sunday, March the 1st at 2 p.m. If you can, please register on Eventbrite so that way we can have a list of the emails that we can send you the private link to. Truly appreciate you taking time to go through this webinar. I know time is precious. I'm a mom as well. I get it. I want you to stay connected with us because we try to put updated information out there as part of that collaboration. If you're interested, reach out to me. I'm on Instagram. I'm on Facebook. We have an email. We can schedule a consultation. The first one's always complimentary, regardless of how long it takes. And feel free to reach out to us for any resource. Thanks again.